Good morning, everyone. Zach Long coming to you today, lead faculty for the Institute of Clinical Excellence's Fitness Athlete Division. I almost jumbled my words there. Today is Fitness Athlete Friday, best day of the week, where we get to talk a little bit about the specific needs of fitness athletes and usually stuff that translates to a wide variety of populations outside of fitness athletes, which is certainly the case today, where we're going to be talking about the biggest deadlift mistakes that I see. In previous podcast episodes, we've talked about the research behind why we should probably be using deadlifts in lower back pain rehab a little bit more often. And there's a couple studies out there that have shown good effects with incorporating deadlifts. And I'll say that this is something that I get emails and messages about every single day of the week. People telling me that they had chronic back pain for years up until the point where they actually started incorporating deadlifts regularly into their workouts. And then they got dramatically better when a lot of other things hadn't helped them. I think there's a lot of really cool stuff that happens to individuals when they start deadlifting heavy as part of their low back pain rehab, which we can't get into today. 2 weeks back, if you want to dive a little bit deeper into how to load deadlifts during periods of low back pain, we did a PT on Ice on that, how to load deadlifts during rehab, where I outlined the different factors that influence how much load I'll put on an individual as part of the rehab plan. So yesterday, I had 3 patients with low back pain that were doing deadlifts in the clinic. So it was a really cool day to get to spend a lot of time doing that. And I just went to the end of the day, I sat down and kind of reflected on what were the biggest mistakes I saw in those individuals' techniques. Some of them had never deadlifted before. Some of them had deadlifted for a long time and still had low back pain with deadlifting. So we're going to go through the 5 things that I saw yesterday that I think are going to be the biggest impactors on an individual's ability to perform deadlifts as part of their rehab plan, or why they may have pain when they deadlift. So number 1, and what I'll see most commonly, and I think I see this most commonly because I work with so many CrossFitters that are performing the Olympic lifts. People think that the Olympic lifts and the deadlift are the same initial movements off the ground, but the setup's quite different. The Olympic lift is going to be more of a push off the ground versus the deadlift more of a pull, where we're using the muscles of the posterior chain. What I see a lot of times is individuals who squat their deadlift, meaning they have too much knee flexion, when in reality we want a lot of hip flexion and a smaller amount of knee flexion. And so we want more of a hip hinge pattern in individuals when they're doing deadlift for the most part. So a lot of individuals end up squatting their deadlift, which is going to push their knees really far out in front of their toes. And for a lot of individuals, they can't then push the bar off the ground and move their knees out of the way of the barbell. So that barbell ends up, as soon as it comes off the ground, it has to travel anteriorly. Now, if that bar travels anteriorly, it's going to move further away from the hip joint, and that's going to increase the amount of stress placed on the low back. And so a lot of individuals just simply changing their setup position to where their knees are slightly further back in that setup, where they're loading that posterior chain a little bit more, will take some strain off their low back with deadlifts and allow them to lift a little bit more weight. The second most common thing I see is people that shoot their hips up too fast. So in that initial pull off of the ground, we want to see that an individual's chest and hips kind of rise at the same rate off the ground. And a lot of times we'll see individuals that shoot their hips up a little bit too fast. And that can come down to one of 2 things. It's either just a straight technique problem, or sometimes it's that the individual starts up in that squat technique. So they start with their knees too far forward, and because they realize that they can't perform the lift optimally, they then shoot their hips up really, really fast. And for those individuals that fall in that category, I just simply change their setup position. And if I change their setup position, they don't shoot their hips so fast. For other individuals, there are a couple things I can do. I can tell them to press through their toes a little bit more. I can try to get a little bit more leg drive out of the bottom of the lift, a little bit more out of their quads. Or sometimes I'll come behind them, I'll put my hand on their upper back, and I'll tell them, as you come off the ground, I want you to focus on putting pressure into my hand. And usually that combination will help to start improving that movement pattern. The third thing we'll talk about is lack of lat engagement in the deadlift. So the lats play a really important role in the deadlift. When the lats are engaged, they're actually going to depress the shoulder itself. And so if we go back to the moment arm, the length between the hip joint and the barbell's attachment to the body, which is the shoulder and upper extremity, if the lats are engaged, that's actually going to decrease that moment arm a small amount. And that small amount is important because according to So stuff like Greg Knuckles, great biomechanist. That's going to decrease the force in the low back by 3 to 5%. So an individual could lift a little bit more weight, or we could take a little bit of strain off of somebody's low back. And so getting that lat engagement is really important. It's also going to matter when that individual, as the bar passes their knees, we want to see that barbell kind of slide up their thigh. Because we want that barbell always moving towards the hip joint, staying as close to the hip joint as possible for the reasons we've already discussed. If they lack lat engagement, when the bar passes their knees, you'll see the bar drift away from their body. And the analogy I always use with patients is you would never carry your groceries in, holding them out in 90 degrees of shoulder flexion. I don't say it that way, obviously. Because that would require significant more work on your body to perform, carrying your groceries in that way. Well, that's how you're doing your deadlift. You're deadlifting with the bar held far out in front of you. And if we simply use your lats to get your lats engaged, we can pull that bar closer into your body and make you a more efficient lifter. Point number 4 we'll talk about is not locking the low back position in. And so for a lot of individuals, this to me is different than being neutral spine. I do want to strive for a neutral spine, but I think we also have to recognize that in some really high-level lifters, having a flex spine can be a performance advantage. That's a little too deep to go into today. But I want to see an individual really locking in that position no matter where they set up. And a lot of individuals will have a really moving low back. And that can come from a couple things. Sometimes they just can't disassociate their lumbar spine motion from their hip motion. Sometimes they just have a really poor hip hinge pattern. Sometimes they have poor extensibility of the muscles of the posterior chain, like hamstring tightness, for example. And so identifying what their issue is that's preventing them from locking in their back, which can also be something like just their body anatomically is not set to deadlift from the ground and they need to lift from blocks. Identifying what that cause is will make finding the solution improving their technique a lot better. So I really encourage people to take the time to figure out why somebody's deadlift pattern would be breaking down. And the final thing we'll talk about is they have a poor bracing strategy. So many individuals think that deadlift and squat performance, when it comes to the core, is about core strength. And research has kind of been clear that abdominal thickness and abdominal strength and strengthening is not correlated with increased performances in the squat. I believe the deadlift as well. And if we think about it this way, like what's your rectus abdominis do? It's meant for creating spinal flexion or anti-extension. Well, in the deadlift, the moment arm, what the bar is trying to do, the bar is trying to crush our spine forward. So it's actually probably more important to spinal extension strength, as well as a bracing strategy, where we learn how to use the combination of all the muscles in our trunk to create as stiff of a spine as possible, using a combination of diaphragmatic breathing, if appropriate, and a person doesn't have pelvic floor dysfunction, diaphragmatic breathing, and abdominal contractions. And that's going to be the most optimal setup for an individual to perform deadlift from, getting a really good bracing strategy in place. So it's rare that you'll see me actually prescribing core strengthening exercises, dead bugs, etc., for individuals having deadlift pain or low back pain, because I just don't believe that that's a very effective tool for doing that. Instead, I'm going to teach them how to brace, and then we're going to use different exercises that really challenge that ability to brace outside of just the deadlift. We'll do things like RKC planks, we'll do stir the pots, etc., to work on that spinal bracing practice. So I hope those 5 deadlift mistakes help you out, get some ideas going for your clients, your patients, or yourself. We got a couple courses coming up in ICE in the next few weeks. Actually got quite a few. On October 13th, Jeff will be in Covington, Louisiana, teaching the lumbar spine course. I'll be in Phoenix, Arizona, teaching Fitness Athlete Live, and Mitch will be in Argyle, Texas, teaching Fitness Athlete Live. All of those are October 13th, so you got one more week to sign up there. On October 20th, Eric Chaconis will be in Philadelphia, teaching his extremity management course. And then November 3rd, our modern dance course will be in Portland, Oregon with Jessica Davis. That's one course that I'm really excited about taking early next year. So check those out. All those courses are listed at PT on ICE underneath courses. Hope everybody has a great Friday.